Thank you.
We turn now to former FDA Commissioner Dr. Scott Gottlieb, who joins us from Westport, Connecticut this morning. Good morning to you.
Good morning.
So these federal social distancing guidelines expired this week. It's a different story state to state over what's opening up. But you tweeted this week that you saw some worrisome signals, specifically when it comes to hospitalization rates. What is the direction of the epidemic?
Well, when you look across the country, it's really a mixed bag. Certainly cases are falling in the tri-state region around New York City. But when you back out what's happening in New York, and New York's really driving a lot of the national statistics because it was such a large outbreak, around the nation, hospitalizations and new cases continue to rise. So there's about 20 states where we see a rising number of new cases. Illinois, Texas, Maryland, Indiana, Virginia, North Carolina, Tennessee have a lot of new cases on a daily basis. And so while mitigation didn't fail, I think it's fair to say that it didn't work as well as we expected. We expected that we would start seeing more significant declines in new cases and deaths around the nation at this point, and we're just not seeing that.
This morning, Dr. Deborah Birx was on another network, and she said our projections were always that we would see between 100,000 and 240,000 Americans' lives lost due to the virus. On Monday of this week, the president said it's probably 60 to 70,000 dead. The week before, he said 50 to 60,000. Are these White House numbers reliable at all?
Well, the White House was looking at the IHME model out of Washington State, and that model initially showed at the high end 250,000 deaths and a base case of 100,000, but it's come down since then to about 70,000. It's starting to creep back up when you look at the updates of that model over the last 2 weeks. I think we have to look out to what's going to happen by the end of June. It's really hard to predict beyond June where this goes because we could have large outbreaks or could become quiescent this summer. But I think when you look out to the end of June, it's probably the case that we're going to get above 100,000 deaths nationally. I think the concerning thing here is that we're looking at the prospect that this may be a persistent spread, that while the doubling time has come down dramatically to about 25 days, so the amount of days it takes for the epidemic to double in size is about 25 now, from days or less than a week at the outset of this epidemic. We may be facing the prospect that 20,000, 30,000 new cases a day diagnosed becomes a new normal, and 1,000 or more deaths becomes a new normal as well. Right now we're seeing for about 30 days now about 30,000 cases a day and 2,000 deaths a day. And if you factor in that we're probably diagnosing only 1 in 10 infections, those 30,000 cases are really 300,000 cases.
Persistent spread is what you called it. So if we're going back to reopening business and life in America, what does that look like? You had airlines this week issue new guidelines. They're asking people to wear masks, giving them to them when they board. If someone has asthma, if someone has diabetes, something that makes them vulnerable, is it safe for them to get on a plane when there's persistent spread?
Well, this may be the new normal, and we need to know what that looks like. And it's going to be a case where people who have comorbidities, have conditions that could lead to a bad outcome if they get infected, are going to need to be very careful. That may be the future that we're looking at. The challenge is that if we see this slow simmer through the summer, maybe the summer's a backstop to spread. I think it will be. But we see this sort of persistent 20,000 cases a day, maybe 30,000, but it probably comes down a little. We see a persistent 1,000 or more deaths a day. That's through the summer. But what happens when we come back in the fall and schools are back in session, colleges are back in session, residential college campuses? People are letting their guard down a little bit more. People are back at work after an August recess. And then you can see this slow simmer explode into a new epidemic or large outbreaks. That's the concern, that if we don't snuff this out more and you have this slow burn of infection, it can ignite at any time.
You've been warning of looking ahead to the fall, that hasn't been addressed yet. You've also talked to us about this drug, remdesivir, that the FDA gave emergency authorization for this week. Is that one of the tools in the toolbox that you say will exist in the fall that could make this better?
That's right. I think the more that we see persistent infection, the more we're dependent upon a technological change to really be an inflection point in this epidemic. Remdesivir is an effective drug. It's going to help some patients, especially when used early in the course of disease, to reduce hospitalizations and reduce death. There's also the antibody drugs that we talked about that could be available by the fall. And vaccines may be available by the fall in doses sufficient to ring-fence infections in cities while we continue to study them to make sure they're safe and effective for mass inoculation. I think the more that the government accepts the fact that there's just going to be persistent spread and they want to open the economy against that backdrop, the more they better be doubling down on the technology and make sure that we're doing everything we can to get those drugs in time for the fall.
You said there may be a vaccine